I've been out of hospital for 2 days. I had my transplant, finally. It's been very weird coming home. It's been lovely. I spent 31 days on the ward, so to finally come home and be with my family has been really nice. And the past 2 days I've been getting messages from other people who are going through a stem cell transplant or family members are soon, and how to support them, what to expect, sort of thing. My experience is very different to what I was warned about in terms of symptoms and my counts and the time frame, and there are still some things that are unresolved. I kind of just want to give some general advice that I've been given to multiple people who have reached out and asked me questions. One of them is my hair. The amount of people who message me and ask, what did you lose your hair? The chemo isn't technically out of my body in the hair cycle until around 2 to 3 weeks time from today, so I can't fully comment on that. And obviously, compared to what I looked like back in the beginning of April, I cut 50 centimeters of my hair off as my own choice, because I started to think logistically about, if my energy levels dipped, I'm not going to be able to look after my hair in the way that I want to. If I'm getting stressed and I see my hair falling out, that's going to annoy me. I didn't want it to start annoying me while I was in hospital, or to have it cut while I was in hospital, already adjusting to a new environment and then adjusting to my new haircut. So around April time, I got my hair put in a pixie, and this is May, June, July. This is like 3 months of growth. I'm getting a tidy up next month because I'm waiting until I know for certain that the chances of thinning or falling out has gone completely. So I'm doing my best, and I haven't had short hair ever in my life. I think the shortest I went with a bob when I was 5. So this is like a very new experience, but it's been very nice to kind of just have that restart, considering I've got a whole new immune system in my body, to kind of just now have a new process to also grow with my hair, and to kind of learn to love myself with my hair growth journey. But that was a personal thing for me, and also about control. I didn't want it to be taken away from me. I would rather have cut it down, or got my hairdresser to cut it down for me, than to say lose it to the chemo. And that was just me personally. But I haven't noticed, like, I've shedded hair, but my shower routine, hair washing routine at the moment is washing my hair once a week, so I obviously shed more at the end of the week. And 2, like, when you're just stagnant in one place, especially in hospital, you do notice the shedding a little bit more because it's all in one place, whereas like on a day-to-day it's spread across different places that you're moving to. So it's not, I didn't find it to be too much of an issue so far. I don't know what the next 3 weeks are going to bring. I'm going to start quite realistic, and it's something I had to deal with. The transplant is not happening until you are in a hospital bed. Now, you can be optimistic, you can have hopes, you can make loose plans about the future, but my original transplant date was the end of April, and we are now at the end of July. I had 2 failed admission attempts. I have had 4 wisdom teeth out, and then finally I got admitted, and I had sepsis again in the span that it would have, like, I should have had my transplant. So things change. Donors get sick, you get sick. I wish that that was given to me a little bit more bluntly as a fact of, you're not having the transplant until you're in a bed. If they call you up, if the bed manager calls you up and you're going in for inpatient conditioning, and they say, right, you just need to come tomorrow and we'll place your Hickman and start the chemo again, you will get a bed that night. It will be, rather than going in the night before the conditioning starts, you will get a bed. But it is soul crushing on another level to be told that there's a predicament, in the bed manager's words, in my case, and you have no idea what's going on the other side, and you just have to wait, and you have to be patient, and you have to then take it up with your CNS. Okay, it's very blunt and to the point, but I wish someone had, like, I live by that now. Nothing's happening until I'm in a bed, or until I've talked to a consultant, or until I've left the hospital, because I can't afford to get myself hurt, and that is a definite protection thing for me. Bring home comforts. So I bought in my 2 oldest childhood teddies, Sophie and Giraffe. Love them so much. The nurses absolutely love them because I would, like, fall asleep hugging them, obviously. Duvet sheets. Obviously the hospital bedding gets changed every day, every other day, because of sanitary reasons. I took 3 double duvet covers with me that then I would rotate and my parents would wash and then bring back in for me, so that I wouldn't have to use the hospital sheet. But I like the hospital blanket because they're quite weighted, but they're not fleece, so they weren't making me have fevers. So I found that having like a double duvet cover, just the sheet, was lovely, especially like on days when I really missed home and we get a new sheet out and it smelled like home. That was so comforting, and it just reminded me, okay, at the end of this I get to come home, I get to have that as much as I want. It also just makes you feel a little bit more settled in a room that is very sterile. Personally, obviously we are advised with the chemo to look for sensitive skin based products for like hair care, moisturising, all of that. I found that the sensitive aloe based hair shampoo care left my hair really dry, and I can't, like, because my hair's so short, using conditioner makes it greasy, so I ended up just using a really basic Head and Shoulders. But obviously every shower it was then testing to see whether or not it was irritating my skin or my scalp, or making me feel like it was burning. So it's very much discretion depending on what you do. I will say I swear by E45. Have a tube by my bed at all times, because sometimes, especially when you've got low platelets, you don't want to be scratching at your skin. You would rather just put something straight on it, let it cool down, because if you're scratching at your skin and you accidentally break the skin, there's so many issues there, especially for me, because I did grow my nails, because I am now terrified of biting my nails because I got sepsis from a broken cuticle. So I'm like, my nails are very like long compared to what they should be to be safe, which is why I have so much E45 on stand by. Take 2 to 3 hobby activity kind of things. I took a lot in with me, and I found it quite overwhelming when it came to actually doing things, because in my head I went, okay, the week of conditioning when I was having chemo, I'm gonna like bed rot, I'm gonna watch TV, I'm gonna sleep, because I don't know what it's going to do to my body. The stem cell transplant and the first 7 days, I was like, okay, I'm gonna start doing some colouring, say, just so then I'm doing something. But I took in colouring books, cross-stitching, reading, gem painting. I took in so much stuff that it was actually unnecessary. It was nice to have around the room, which is the only plus side that I could find, but it did make like getting down my craft box a little bit heavier, so I couldn't always say one day, oh, I want to do that. Communicate with your support system, your external support system, the people that you know are going to be coming in and visiting you, the people online on our communities that you've talked to about what to expect. Keep talking. Even if you just message to say, I'm having a bad day, but your support system is key. For me, I had so many things that I wanted to complain about that weren't that deep, that I didn't want to act on. I just wanted to complain, because in that situation I had no control. During my hospital stay, I had very little control over very little things, and the few things I did have control over didn't always go to plan. So to have someone to complain to, for me, kept me sane, because then it kept me communicative with my nurses in a productive way. You know, I was a little bit blunt here and there with consultants, because they're the front line of communication really that actually makes an impact, whereas nurses I can complain to and I can talk to and I can have a joke with, because they're on the floor, they're seeing it firsthand rather than looking at a book, you know? So really use your support systems, especially just wanting to spend time with people, phone calling people. It's very lonely at times, especially if you're not having horrific symptoms. There's a lot of alone time, and for me, I couldn't cope with that all the time, so I needed to talk to people. Ask for help. If you're having pain or sickness, ask for the drugs. It's not worth your energy to try and just get through it. Your body is trying to take on someone else's immune system, and you just need help in that moment, and there's no point trying to do it all yourself. If you need help with movement or you can't get something, you buzz all the time for the nurses, even if it's as simple as, I can't fathom the idea of getting out of bed right now, but I really need that thing that's on the side over there, could you please pass it to me? They will pass it to you, because they would rather you buzz than try and go and do it and fall. And if you're having issues with physio, ask for more help, ask for more support, and that's all you can do. And ask for specific things that help you. For me, I am 6'4", and the bathrooms in King's wards, the sink is always very low, so I always need like a chair somewhere near the sink so that I can actually do my teeth and do my mouth care, because I can't stand for long enough to do it, and it also is just a pain to have to then bend like halfway over to use the sink. So I got a chair and it lived in the bathroom under the sink. If there is one thing you take away from this record everything. If you are having a daily consultation with your doctor or the consultant on the ward, record it. Even if it's as simple as, oh, I'm not having any symptoms, record it. Because if they give any sort of information that then you rely on and they say that's incorrect, you need to be able to feed back and say, well, on this day, this doctor said this. Because the amount of times I was given false information that I then relied on thinking they were fact, and then they would change, was unfair. I think for me, also being a aplastic anemia patient rather than, say, a blood cancer patient, it's less well known. It's not studied broadly, it's not understood. So there are some times where consultants who didn't know my case personally were assuming I was a cancer patient rather than an aplastic anemia, and I would have to remind them, hey, I have no idea what you're talking about because I've never had to do this stuff before. If you can't comprehend what's being said that day, if you record it in a voice memo or write it down, you can then send that to someone else who can comprehend it for you. I wrote is ask until you understand. It is your body, and if you want to know what's going on, you keep asking. If you want to put your trust in them and say do whatever, that's another side you can take. But for me, I needed to understand everything that was going on because I have been managing so many of my symptoms by myself since January. And again, it's a control thing that I have always had. So I needed to understand medically why certain things were happening. And I didn't need them to beat around the bush or sugarcoat it. I just needed to understand the logistics. Sleep. I was in hospital for 31 days. I think around 75% of that time I was asleep. I didn't like the fact that I was in four walls, so I would sleep to escape that. Didn't like the fact that sometimes I felt like a spare part and things weren't happening, and I couldn't feel, I had very few negative symptoms, so it didn't feel completely real that the transplant had worked or that the transplant was even worth it, so I slept to avoid it. I was also very fatigued, so I slept. I didn't fight it. If you need to sleep, sleep. Doctors and nurses and consultants will wake you up if they need you. You're not going to miss out on something just because you need a nap. If you need a nap, take it. Do not try and fight it and make it through the day, because if you can't sleep at night, then you can always ask for extra medications to help with sleeping. But for me, I found being up at night rather than during the day was actually more peaceful because there's less going on. If something doesn't feel right, say it. There were too many occasions where I was nearly given the wrong medication. There were too many occasions where consultants had said one thing but they hadn't written up the notes yet. There were times when I was on the magnesium drip and I felt a very bad burning sensation, and it basically just ended up being, rather than 2 hours, I needed it across 4 hours because it was going into my body too fast. The same with cyclosporin, I needed it to go over 3 hours long rather than 2. If it doesn't feel right, say something. Ask for the nurse in charge. You are not a problem. You are a patient who needs help and comforting and reassurance, and to know that what is happening is the right treatment. For me personally, I set a goal. My neutrophils since January have been kind of sat at around 0.06. And I set the goal of when I hit 0.5 during my inpatient stay, I would be allowing myself to go outside, to leave my room. I didn't leave my room to go into the common area. I just stayed in my room. I was in there for 3 weeks before I was taken out to have a ultrasound. The next day I had an x-ray, and then on Saturday I hit 0.5 and I was able to go outside in a wheelchair and sit in the sun with my dad for a little bit, and then sit in the shade, obviously with a cap on because of the cyclosporin making my skin sensitive. But have a little goal like that. It really annoyed me that it took me 3 weeks to hit 0.5, but once I hit that and I was able to go outside, like my window looked at a brick wall, so I couldn't see any greenery, foliage, nothing. I had a brick wall as my window view. And just the joy of actually being able to leave the hospital for a couple of hours to sit outside the hospital, it made all the difference for the last kind of week of my stay. Numbers. Now, for me, since January, I have been very focused on 3 numbers. 4 numbers. My HB, my platelets, my neutrophils, and my CRP. Those 4 things are the 4 things that I have tracked since January, week by week, and have been very obsessed with. And when I came into hospital, I took whiteboard pens with me, knowing that I would need a table on my whiteboard of what results I got each day. Because while we have like the NHS app, results don't come out on it until the day after, and I needed to know for my own sake what was going on the day of. So I had a table and I had my HB, platelets, white blood counts and neutrophils written, and I got the nurses to write my results every single day, so I knew what was going on. It also helped me understand, okay, I need to have blood products today, I need to have platelets today. And then on top of that, I'd be like, okay, is there any other supplements that I needed? Yes, we need to put you on fluids, we need to give you magnesium, we need to give you potassium. Okay, that's fine. Just keep asking and trying to understand it was really important to me. And if you want to know your numbers, just ask. And if it takes them a while to come back, ask again. Because sometimes a nurse will forget to, especially if a nurse who answers your buzz isn't your nurse, they will sometimes just not remember to run into your nurse and tell them. So just keep asking, and if you want to know that information. Okay, I talked about my E45. Put it in the fridge. King's wards have fridges in the room, and it was a godsend, especially after magnesium for me, because the magnesium at a fast rate made my skin feel like it was on fire. I would put E45 on to try and soothe it in some way, shape or form. Lifesaver. Food deliveries. My parents came and saw me 5-6 days a week, and at the moment King's is upgrading certain things in their kitchen, so there are issues with food, is what I experienced. I don't know how long that will last for, but that's what I experienced in the last month. Of if I wanted hot food, I knew to order at lunch, because I was more likely to get a hot plate of food at lunch than I was at dinner. So at dinner I would order like a sandwich, and even then they sometimes didn't have the sandwich that I wanted. So having my parents go and say put like a pesto pasta from a meal deal in the fridge for me that I could then just grab if I was hungry, or a wrap or a sandwich from a shop that's like wrapped and sealed. You know, being able to just say, okay, whatever, because I'm quite a picky eater, being like, I don't want any of them options, I've got food in my fridge, was really useful for me. We're on to like the last stretch now. Nurses' names. I made a conscious effort while I was in to remember each nurse's name. I started by, like, I had a couple of days where I was writing things down and saying what nurses I had, and by the end of it I was able to actually like identify people before they told me, which was really nice, and it just makes you feel a little bit more human in a very clinical setting, and it makes you feel like you're having that socialization that you don't really get. Everything's very much matter of fact, like talking about your medical stuff. It's not like a conversation with your friends. So if for me it was very much like I need to learn people's names and I need to remember them, because I'm good with faces, I'm just not good with names. So I made a conscious effort during my stay to do that, because it's easy sometimes when you're seeing so many people to just not remember names and just think, okay, this person's not going to be here tomorrow, why do I need to remember? Because it makes you feel a little bit more in the moment. Buzz the alarm for help. Do not be scared. If you want a fork, buzz. If you want a spoon, buzz. If you want a new jug of water, buzz. That is what that buzzer is there for. They don't want you leaving your room and going to the nurse's desk and saying, can I have this, this and this? They give you a buzzer for a reason. And you don't become problematic because you're using it. You are doing something that actually helps your recovery. Do not feel awkward about using it at all. SOS support. Now, obviously, if there's an emergency medically, the hospital will have your next of kin numbers. For me, I had 2 people on call that I knew that I could always call. Whether it was the middle of the night and I'd just been given some really weird news about the next day, or I'm getting ready to leave and be discharged and I've had one of the most scariest anxiety attacks of my life that made me feel like I was dying. I had my 2 people I could call. Thank you Eve and Helena. And you don't even have to talk about what's going on, you can talk about anything else. But sometimes it is just too much and you need your SOS numbers. And I am so grateful I had 2 amazing SOS numbers who picked up without question. And for me, leading on to my second to last point, socially, I, as a young person who was in uni, have found this whole experience so strange to understand, and so strange to then understand on my social level, of knowing who can I talk to, who wants to talk to me, even if it's not medically, just actual like genuine conversations, and reaching out and being like, hey, how's today going? And me being like, I haven't moved, how's your day? And actually wanting to hear about how they're doing in uni or work or socially. Like, I don't always want to talk medically with my friends, and I found 2 good handfuls of people that I can talk to that aren't family, that are just my friends, and I am holding them close forever, and I'm keeping myself quite closed off from everyone else for now. And for me, it was just more about talking about my experience so then someone else doesn't feel lonely. Because from diagnosis in January till I want to say the end of April, I felt so alone. And then I met an amazing girl called Sophie on the Aplastic Anaemia Facebook group, and she has been such a rock for me. But also mentally, I had such a big switch at the end of April with medical stuff of how I would approach it, that I don't want anyone to have to go through that, because those 4 months were so difficult mentally for me, and I don't want people to feel alone in this, especially if you're a young person or you are a relative or a friend of someone who is going through this, and you just want to understand more about this very rare and complicated disease that just really has no rhyme or reason to it. And you know, my DMs will always be open on Instagram, because it is just so important to me that no one feels as alone as I did at that point in time, because I had no idea where I was going to be sat in 2 weeks' time, and I had dreams for 6 months' time, but I couldn't even think about the next day, and that was awful as an experience. And finally, listen to how you're feeling. I've got some kidney issues going on, and I've got some liver issues going on, and those are all being monitored as an outpatient. And obviously there is always going to be the threat of graft versus host disease. But the difference is even though my numbers didn't pick up as fast as the doctors wanted, I feel so much better. I feel so much stronger than when I went in for my treatment. And that is what matters, because they can look at numbers and they can look at what's going on medically, but they aren't the ones living with that medical stuff day to day. So I am clinging to the good feeling that I am having at the moment, because no matter what my numbers are saying, I feel good. And I'm being safe, and I'm not going anywhere other than the hospital for the next 100 days, because that is the smart thing to do. And I'm very limited on who I want to see and how I'm going to see them, whether it's outside or inside with like doors and windows open galore. But I know that if I follow everything they have given me and I continue to feel better, to me that's all that matters. Because the last 2 days have been so freeing. I walk up the stairs and then I need about 10 minutes to catch my breath. I walk down the stairs, I need about 5 minutes to catch my breath. That's fine. I'm walking up and down the stairs, and that's something different that I was struggling to do. Antibiotics for 12 days, and I didn't have a feeling of fever or chills or any issues whatsoever. And so long as I kept reiterating that, the doctors understood how I was feeling, and I accepted the fact that yes, they're seeing something and I need to be on the antibiotics, but as long as they knew I'm not having any of these symptoms that you're expecting me to have, it made life so much easier for me to then feel listened to. Kind of just wanted to put this video together because so many people have been messaging me and I'm repeating myself quite a lot, and I'm also trying to deal with getting back into a routine, and I'm writing like uni-length essays trying to explain myself, and I don't come across the best emotionally over text, so this is my way of saying everything I need to say. I had very few negative side effects. I didn't have a major infection spike. The only major real issue I'm having is that my counts aren't progressing as fast as possible, and I had an issue in my liver and kidney. My liver is slowly getting back to normal. My kidney is so-so at the moment. Just take everything I'm saying with a pinch of salt compared to your situation, but it is useful to hear from someone else who has just experienced it, and I'm not gonna sugarcoat things in any way, shape or form. My DMs are always open on Instagram, no matter what, and if you are about to go in for a stem cell transplant, good luck, and I hope you get the best care possible.